and are in the process of crawling through the vessel walls, whereas others have already left the vessel and are seen in the surrounding connective tissue. When the blood flow is stopped temporarily by gently clamping the vessels,
Look at all those
we
red
can
blood
appreciate how densely both vessels are filled with red blood cells. Red blood cells do not interact with the vessel walls and move so fast under normal flow that we cannot see them. When the blood flow is restored, some of the leukocytes continue rolling, whereas all non-interacting cells are immediately washed away by the shear.
Pretty cool.
Wow.
All right, question before we get that over break. Yeah,
I have a couple. So my first one is, whenever the leukocytes interacting with the selectin, is that leukocyte considered activated at that point?
okay, we're talking, see, this is where it gets a little confusing. We're talking about T cells. Naive T cells have L-selectin on their surface, and they use that to get into lymph nodes. In this case that we're talking about here with the neutrophil, they have L-selectin on their surface, but they're not any kind of activated. We don't consider them ever naive versus activated, although cytokines can fire them up a little bit. So they have L-selectin on their surface all the time. They don't go through a activation state like the T cells do to go from a naive to an effector, because neutrophils do the same thing all the time. T cells, as a naive cell, don't know what to do. They have to go in and get in touch with their antigen, and then they become able to go and bind. Now, if they had L-selectin on their surface all the time, then they would be getting in everywhere else like the neutrophils do. And we want them to go just to where those addressins for that inflamed vascular endothelium is. So it gets a little confusing when you have the same molecule on two different cells doing two different things, but it still works. Let's just say that. Just take my word for it.
And then, so off of that,
Yeah.
off of that, then are ICANS only neutrophils? So neutrophils do not have the VCAM; they're strictly ICAM.
VCAM is VLA4 that binds the VCAM is fairly much a T cell only. The ones that's called ICAM actually is recognized by lots of cells. It's ICAM is intracellular adhesion molecule, and it is recognized by multiple receptors, and these receptors are found on lots of cells. And so they're involved in tight adhesion between T cells and dendritic cells, between neutrophils and vascular endothelium. There's only a few that are really specific, like VLA4 and VCAM in this particular case, to get an activated T cell across there. But you're getting into details that I don't know, I wasn't open to get into, but I'm excited to hear from you. You're liking this stuff.
For this rolling adhesion, we're just talking about neutrophils, or the all lymphocytes?
The lymphocytes will do it too, but they won't. I don't have a good answer for you. The lymphocytes have to slow down, but they're not going to do it through the same mechanism.
Okay.
They will have something, so the leukocytes, so I would say the neutrophil was binding via E-selectin and P-selectin, and the T cells will be rolling in the same way.
Okay.
So E-selectin and P-selectin are put up on the endothelial cell, and it's going to interact with different things. Neutrophils also have L-selectin on the surface that they use for other things, but it starts to get a little confusing. But if you want a white blood cell to get into the tissue, you have to have rolling adhesion,
Okay.
and that's going to be mediated by the E-selectin and the P-selectin at the site, and then some tighter binding to get them over. Now, don't anybody ask me how a monocyte gets into the tissue when it's not inflamed, because I don't know. I have no idea how they get in there, if there's some kind of mechanism to slow them down so they can get in there, or what happens there. But we certainly do see monocyte and dendritic cells, and in some cases neutrophils, already in the tissues. It could very well be that they're just hanging out from they've already been in the infection and they just stay. I really don't know. All right, we're gonna shift gears and get into antibodies and antigens and what B cells do. Let's get going, get about 5 after.